Okay, we are going to begin our exciting case discussion sessions. Okay, hello, hello. So may I request the panelists to, if you come to the front, then our first case is going to be discussed, and the session is going to be chaired by Dr. Cansu. No, there is no spelling mistake. I always say it's Jansu Janja.
Yes.
And I have to thank her immensely for her contribution. And she's going to chair and lead the session. So, Jansu, go ahead.
Thank you. Okay, so I'm just gonna present you a case, and I will, if I can have all the panelists take their seats, please. All right, let me start so that we don't run out of time. I'm just going to present the first case and ask some questions that sort of starts the discussion, and then I will hand over to the panel to discuss more. So let's start. Ms. Kwan is in charge of a large old-age home facility. This is privately run by a community-based but for-profit organization. A placement and maintenance fee. Oh, sure. Sorry. Keep talking. Okay. A placement and maintenance fee is charged for places in the OAH. Madam Lee is 85 years old and is a resident in this facility. She has mobility problems because of her hip arthritis, but she is mentally alert, usually cheerful, and enjoys when her family visits her on weekends. One weekend, her 5-year-old great-granddaughter notices that Granny has a very foul smell and refuses to sit next to her. Indeed, Madam Lee's son realizes that his mother has been fitted with a diaper and that it has not been changed. He was not aware that she was requiring diapers. So the family talks to Ms. Kwan. They make inquiries. The head nurse explains as follows. Madam Lee cannot get to the washroom independently, and the home cannot spare the manpower as they have a very large patient load, and especially on weekends when a large number of relatives visit the home, there's a relative shortage of manpower. Therefore, a diaper seems a reasonable alternative instead of helping Madam Lee to go to the toilet. So the basic points are Madam Lee doesn't have any mental problem. She's alert. She knows what's going on. She can make decisions. But she just has problem with her mobility. She is not comfortable. She cannot go to the washroom independently. She needs help. And the home just does not have enough people to assist all such patients. So then Madam Lee is very upset and does not agree. She feels her dignity is compromised and does not want a diaper. So here are some questions, some ethics questions. How would you view Ms. Kwan's actions? Does she do the right thing? Is she acting in the patient's best interest? So this goes back to Professor Kumta's presentation of the 4 principles. Does she respect her patient's self-determination? And are there countervailing arguments to support her? And this goes back to both Professor Kumta's and Michael's actually presentation about resource allocation and the scarcity of resources. And can Ms. Kwan act in the best interest of all her patients? Can she respect all her patients' self-determination? And is the for-profit nature of the OAH, a consideration in any way? So these were my opening questions. So if I can now have the panel take their place. So whoever would like to start.
Okay, let's kick off. I had a mother in nursing care for the last 2 years of her life. She died a couple of years ago with severe Alzheimer's, and she was physically still very fit, which is a bit of a trouble because she still went for walks, right? And she didn't know where she is. Nobody knows where she is. but she was happy out there. Now, but before that, she was so determined to keep her dignity alive. Whatever it was, right, she wanted to make her own decisions. She didn't accept decisions, and that from other people, which drove everybody nuts, by the way. But she was very clear that even the choice of food, the choice of her flowers, the choice of the bed linen should be up to her and not to someone else, because I felt that this was the last thing she really had, the dignity, right? To be an individual, not to be a number in an institution. And I felt, I liked that, right? And so coming to this case, I really feel that as an institution, or as someone who runs an institution like this, the dignity of their subjects, their patients, I wouldn't call them inmates, is absolutely must be on the forefront of their mind. So I would argue that just because of staff resources, of resource issues, and obviously this is not a one-off scenario, but a scenario that seems to be repeated weekend after weekend. I think there should be better options, right? Maybe Ms. Kwan should look for more resources, should make a case for more resources, or find other efficiencies in the system. But to touch on the dignity, in particular, if a person really clearly makes a point that she's alert, that she makes a point that she doesn't want to be touched on her dignity, I think then it's not the right decision just to order diapers.
Let me chip in a little bit. So I'm a philosopher. That's why the word dignity always makes me uncomfortable, because I think it's very murky. But I think here it's actually also in what you are talking about, it's quite clear. What we are talking about is basically a person's decision-making capacity. Just respecting a capable person to be able to make the very important decisions about her bodily, her body and her basic life, basically. And here, it's not, I don't think there's any question whether her dignity is violated. It definitely is. Michael?
I completely disagree with your
my dignity
your
approach.
understanding of dignity.
Thank you. This is
I'm
a philosopher against philosopher.
I'm not at all worried about using the concept of dignity, but I think that we could very intuitively see, even in a case in which the elderly patient had lost decision-making capacities, we still need to care about their dignity. So I don't think dignity is just a matter of enabling people to express rational choice. And I think leaving patients in unclean diapers would constitute a violation of dignity. I think we'd intuitively recognize that. I'm not quite sure what the conceptual basis would be, but I don't think it's necessarily tied to her decision-making capacity. On the case itself, I just have a couple of remarks. One is that an obvious failure on the part of the care home manager here is one of disclosure. When it comes to justifying the decisions that you've made after the fact to aggrieved relatives, you've got an indication that something has gone wrong in your system. If you'd been upfront with people before they had actually got into this situation, then the patient and her family would have had an opportunity to, sort of buy in or not buy in to the kind of treatment that was going to happen. I don't think that the for-profit motive is necessarily, or the distinction between a private and a public provision of these kind of facilities is necessarily going to make a big difference here, because we're going to have scarcity of resources in either case. In the for-profit context, the family would have a different lever that they can push, which is they can say, am I getting good value for money here? If not, maybe I'll take, my mother and move her to a different facility. So I think in some contexts, for-profit treatment centers can offer a kind of accountability which might be lost in a system of public provision. But I think really that the crucial point here is we have to ask how it's got to a situation where these justifications or this conversation has to happen after the fact. Why were these details of how the patients were going to be treated or how the lady was going to be treated not made clear to the family and to the person before the visit, before the person found out about it? And I think that's quite crucial.
Can I add a comment? I think Michael raised an interesting point, and this is the power that is given the relatives of a person who is either in full mental capacity or not, but in this case, where the lady has full mental capacity, what the heck has the family to say? Kind of, you can ask this question, right? Even if they were informed, is their consent necessary? Is what happened if they disagree, and the person agrees? So it's an interesting. I believe it's an interesting concept to say that if people are in an institution like that, then the relatives, son and daughter, have more to say about the fate of this person, right? Even if they pay for it, maybe.
Right. I mean, I think that shows us that. I mean, I want to stop so that Dorothy can give her opinions on this. Just very quickly, I think that really brings up interesting issues to do with consent. And we talk about this woman as having capacity, which no doubt she does. But the context in which you're working can really put pressure on and influence your decision-making capacity. So one question we might ask is, well, she says she may well say that she's happy with it when she's asked by the nurses and unhappy with it when she's asked by her family. And so external voices there are helping, counterbalance the institutional pressures that she might feel to go along with the system. Yeah.
I guess it's also very relevant what practically viable options are available. If this is the only place that she can be, she might agree to be okay with it just by pure desperation. And also, I think one thing that both of you pointed out is that it seems like there's a dichotomy between either this is going to be the case or she's going to reject it, but where more resources could be looked for. But there's also the possibility, what if there are really no resources available to, let's say, Ms. Kwan or to most of the nursing facilities? Dorothy.
I may interpret it from my nursing perspective. So this is a very interesting case because we in Hong Kong, many nursing homes or OH homes face the same situation. And for Ms. Kwan's action, I believe all of you may not agree for what she do. She asked the lady to have the diaper and due to lack of resources, and so nobody can help to change. So it is obvious not for the benefit for the clients, because from nursing perspective, I think it is our duty, or we opt to provide the best care for our clients. But lack of resources is not a reason that we not should do so. Or if in such case the Ms. Kwan really have such lack of resources, we may also involve the relatives, the family members to help in the care, such as changing the diapers. That is what they can do for their family, their mother.
Although, if Mrs. Kwan, if Madam Lee is completely mentally fine, functional, then I'm just thinking, does Professor Kumte, you gave me the case. So can she not talk to the family herself? Like, do we have to rely on the Ms. Kwan's disclosure?
So actually, this is a real case, and the issue is not only changing of diapers. The issue is why put diapers? And I think the panelists are amazing because they picked up some of the nuances. The first nuance, I think, Dietloff, I totally agree. Why should the old age home actually not ask the lady herself? She's in full decision-making capacity. But in reality, because partially funded or private nursing homes, the person who actually pays the money are the relatives. So that's where the power imbalance comes, and they perhaps they may understand, but they think that it may not be so important, and I think that's the first violation. The second is also the enormous power differential. Again, you're going to have the relatives come and support you as you're in the old age home once a week, maybe once in 2 weeks, maybe once a month. But she has to face the environment of not Miss Kwan, but the other people who are helping. And because she knows the reality, she finds it very difficult to challenge them. So she does not have the power to challenge, and therefore she would rely basically on, in fact, she's not relying, she has secondarily made a complaint, not a primary complaint. In fact, it's the son who discovered that she was on diapers, and nobody had told them, and she probably accepted diapers very reluctantly. I don't know the details enough to say whether she objected or not, but I think the power differential is here. And my third question, I think Dorothy, you've raised this as well. I think doctors and nurses often think that things are acceptable. It's quite okay. Quality of life is quite okay. I mean, we generally tend to average out what's happening, but very seldom, especially in a situation where there is an issue of resources, we tend to look at what is the average that we can do. And I think all these issues play up because I think there's definitely violation of the individual's self-determination and autonomy, although I sense it was not penetrated because the environment in most old age homes is so tough, even in the ones that are privately funded. And I think Michael raised this issue whether, okay, there's the for-profit nature, but in Hong Kong, actually, there is a pressure, even if you have money, there may not be enough places for old age home placement.
Yeah.
So, all these things play into consideration.
Can I ask whether how did the case play out later? So once the son complains, what happens? Is there a change? Were there a change in the treatment?
In this, I'll tell you what happened, but let's penetrate.
Sorry, but I'm okay. Fine, we can do that. So
we can ask questions and maybe more, but
I want to sort of do the cards.
Yeah,
I'm
sure.
curious, so
Yeah.
we can keep going with the questions after the cards.
Yeah,
Is
sure.
that okay? All
Yeah.
right. So does everybody still have their cards? Yes,
Yeah,
good.
the red and green.
Okay. So the first question up there. Do you think that she did the right thing? So yes, she did the right thing. Is green, obviously. No, she didn't, is the red. So put a red one if you think she didn't acted rightly. So she did the wrong thing.
Everybody vote now.
So green for right and red for wrong.
Can you raise it up so that we can see?
Okay, so we have some. The majority is red, definitely, but there are some green cards. Can I have somebody explain the why they think that she did the right thing? So somebody who has a green card, can you?
Yeah, CK, you had a green card.
I was expecting, yes.
I think definitely we have to respect the dignity of the patient. But I think there are options on the care for this lady. The one option is like this lady's request to take away the diaper and then ask somebody else to help her to the toilet. But that is in reality, that doesn't happen. That could not happen because of lack of resources. So the outcome will be the lady will be wetting in the bed. And then actually that may not be taken care immediately by the staff. Like you can imagine that wetting the bed and then being wet in the bed for a long period actually is even more harm to her dignity. So I think it's a relative. When we are looking at the reality, if that is the best that these staff are doing, that already improve her care, I think that is still acceptable. That is why I think it's so-called right. I don't think it's optimal. It is not optimal. It is suboptimal. But with that scenario, I think that may be the best available option that is to the lady.
So
Okay, thank you.
coming a little bit from a pure business perspective, right? If you have and I'm not talking insurance now, just general running a facility, running a business like an old care home, and you have a situation repeatedly that is unsatisfactory, you have to find solutions because this is brand damaging. This is just a poor business performance, and from that perspective, to find solutions that reduces the risk of this to happen has to be on the forefront. And that may closing beds, right? If you don't have enough staff to treat them with dignity, close the beds. And treat those who are there and pay for it the way they can expect to be treated. For example.
I totally agree that it should be taking action to avoid this to happen. But we are talking about the staff, Ms. Guan.
Sure.
She is not the administrator. She is doing the job to take care of the patients individually. So it should be the house manager who should be thinking of ways how to improve this situation. If they cannot do it, then the clients will go away, then they will have a close down of their business.
Also, I'm not sure if I get my economics fully right, but isn't it the case that when there is a very desperate demand, then as long as the supply side is not in a healthy competition, you can basically really lower the standards of your services? Isn't that right?
Absolutely.
Okay.
I mean, but and I think that was mentioned, right? The Hong Kong scenario is really desperate.
With the aging population.
With the aging population and the reliance on amas, right? On domestic helpers, that is quite prevalent. Yet, when it comes to more advanced care needs, that is where Hong Kong really starts stuttering, and we find that we don't have enough facilities.
Yeah. Are there any questions or comments from the audience? Yes, please.
Just a comment. Actually, I put red color cuff, but I think there's no absolute right or wrong. Resources is an issue, but on the other hand, the patient's dignity needs to be respected. So if Ms. Guan is so busy, I mean, in terms of the manpower constraint, she could not afford to carry the patient to the toilet for proper, voiding. A diaper is a solution, at least temporary. But they need to make sure or ensure the diaper is being checked regularly. So a diaper run is necessary. And if they can do the diaper run on time and help changing the diaper whenever it is wet or soaked, then I think it is an acceptable option in this kind of situation. So I think we need to, actually, it's not that superficial, just right or wrong. It's actually a balance or a compromise sometimes. So that's my comment.
Yes, sir.
So going back to the Michael's talk about the justice, I think we can use the sort of concept of the between justice and justifications. So I guess the Ms. Kwan's action to wear the diaper may cause less harm over the benefits. Maybe there are more harms not wearing the diaper. Maybe that could be justifiable, but I don't think that's right to do. So there may be some action could be justifiable, but that justification doesn't really kind of ensure that it's the really justice to do or not. So I think we should distinguish between justice and justification.
Thanks. Just quickly following up on that, I suppose. There's a difference between suboptimal treatment and neglect. And I think that a lot of that comes down to the difference in motivations or demeanor of the person who's giving the treatment. And that's a detail that we really are missing out in the description of the case. We have to fill in how we're imagining this conversation to go between the family and and Miss Kwan, and we're also missing out details on what the attitude is like of the relationship between the old woman, the mother, and the staff, and that's going to make a huge difference, I think, and that difference probably comes down to something like respect. Or some kind of respect for dignity. And this is the point where, in trying to explain the difference between suboptimal treatment and neglect, we need to appeal to these kind of concepts. And so that's just an observation.
Can I make a comment on the damage you mentioned? The potential damage and sort of a weighing up of damage. I think we also have to see that there might be a sort of, if you like, psychological damage on the part of the mother, right, who's embarrassed when her daughter tells her she's not smelling very nice. That has to be, in my view, to be taken very seriously, right? And yes, you're talking about the damage of a wet bed or a wet diaper. So I think it goes beyond that, right, when we talk about damage.
Any other comments, questions from the audience? Just one thing that I want to add to what you said. The psychological damage, I completely agree. The whole well-being question has to include not just the physical well-being, but the psychological care of the patient as well. But going back to Professor's point, if there is not enough resources, then what we are comparing is to not diaper versus well-care, but diaper versus the mother wetting herself and not being able to see the relatives or something like that. I guess that's the main. Whether or not this is a real resource question is one of the questions, I would say. So if there are no more, oh yeah, one more.
I'm from the, sorry. Hello, I'm
It's
from the
working.
medical school. I'd like to bring out maybe not really a new perspective, but I think we need to take a step back. How did this situation come into, well, how did this situation develop into what it is? Because, well, I have two assumptions. Maybe the elderly home, it's privately owned, so they make money out of it. So in the first place, they have to manage their own resources, and they can take new patients or not. So they can say we are full, we don't have enough resources, so we'd rather not take new elderlies. So maybe the problem is, in the first place, that elderly home company wants more profit, or maybe they want, well, cover more of their cost. So they are actually, with their already limited resources, they are trying to compromise the well-being of their existing patients in order to accommodate new patients who would also not benefit from not benefit from an optimal care and treatment. So I'd like to, what I'd like to bring to the discussion is, it's not, maybe it's not entirely about wetting the bed versus diapers. It's more about the mindset of the operator of that center or of that elderly home. So, well, that's my thought. Thank you.
I think that's a very good point. One thing that, I mean, obviously one question is that where do the profit go, right? Like for the for-profit nature, where does the profit go? Again, but there's one point not to miss, if I'm again getting my economics right. not taking more patients might mean that they have to increase the fees for the existing patients. So that might be another problem depending on what people think that is acceptable price to pay for a nursing home. Should we? Yes, I also would like to hear the rest of the case, I think, now from Professor Kumta.
Actually, first, I want to congratulate the student for actually really raising the issue that the so-called fiduciary responsibility also should be extended to the people who are managing the old age home, because I think that's exactly what you said, and I think it's a fine balance between clever business management, not at the expense of obvious deterioration of patient care. And then I think what's happening here, and that's why I want to congratulate him, because he is cleverly, intentionally or unintentionally picked up what is hidden here. We are immediately focusing on Miss Kwan, and in my view, actually, given her position, she's not the owner, she's basically an employer. I think she's acted in the best interest of the patient. Because as Dr. Lee said, leaving somebody who's got limited mobility, waiting for a helper to come and get to the toilet, is going to have the risk that she will bed wet, and she'll have wet clothes, and that'll be even worse. So balancing these two, I think, I believe that Ms. Kwan's actions were in good interest. And again, I agree with Michael that some of the fine details are missing. We assume that Ms. Kwan has, just applied the general brush of average. Everything is average to a common denominator. And in reality, actually, this was not so. So I came into, the reason I was involved was because the family was wondering whether perhaps joint replacement or something would improve her mobility. And clearly, they came to us through people we knew. And eventually, the resolution was that the use of a diaper was probably in the patient's best interest, because it would be unreasonable to expect improved mobility. And that repeated changes, reminders that when the diaper was indeed full, that the lady could ask for a change of diaper. And that was the eventual resolution, because I do think that there are technical limitations to people who have mobility problems, because sometimes people feel that they can go to the washroom with a little bit of assistance, but that little bit of assistance is huge amount of resource and time development. So I think one of the issues that was raised was no prior discussion. And I think, Michael, you're very sharp. Ex-ante versus post-ante disclosure raises the issue. Was that properly discussed? They should have engaged the family, because the person may have some disagreement, but you need to educate both the patient as well as the family. Eventually, it happened, and there was a successful resolution. So she's back on diapers and still living in the same old age home.
So the resource that she legitimately requires is more frequent change of diapers rather than no diapers.
That's
Is
correct.
that right?
Yes.
Okay. Any last words from the panel?
That's good.
Okay, so
Leave the last word to Shekhar.
Okay, I have the last word then. Sorry, Shekhar.
Oh, you guys still have to hear, because there's one more case in this panel, and then you change.
So there are a few obvious ethical considerations. So one is about the distributive justice. How should we allocate the resources? So this goes also to the threshold care for everyone versus good care for some, or maybe what Michael was saying, with whether it can be suboptimal, but just neglect the difference between those. And how do we define, of course, if we are going to go for threshold care because we just simply do not have enough resources, then how do we define this threshold? How low can we go in order to cover everyone? This is a problem that obviously the discussion in universal health care, universal health coverage also has. Violation of individual autonomy for the benefit of others. This is what Madam Lee what Madame Lee wants versus not taking other resources from the other patients. And there's also this question about the resource allocation for aging population as well as the treatment of aging population, because similar, sort of following what you said about the Ms. Kwan's preference to discuss this with the son or with the children rather than with Madame Lee, even though she is competent to hold this discussion, I think there is a very clear discrimination towards aging, towards elderly, regardless of how sharp they are in their thinking. So there's usually a prejudice that they are not going to be able to reason well or think well. And of course, how as a society we want to allocate the resources. How much are we prepared to allocate resources to the aging population? And if the system is dysfunctional, if public nursing homes or private nursing homes just simply cannot provide even the threshold, then what is the right thing to do? So if Ms. Kwan is not in a position to change the system, then how should she be acting within this restrictions? How far does her responsibility reach, and who share the responsibility? Clearly, there is a state responsibility to regulate these public and private nursing homes. There is this responsibility of the staff within the nursing homes, but there's also the responsibility of the relatives. How much should we hold them accountable for Madame Lee's problems? Any further last words, Professor Kumta?
No, I think we'll
right.
think over these very profound philosophical questions that you
yeah.
raised.
Yes, and I would, going back to Michael's point, maybe we should have another meeting on dignity, because I strongly disagree with what you just said.
That's a wonderful topic for our next workshop. So
I'm very happy to do that.
Cansu, thank you very much.